talk about the first measurement that we really use in our clinical practice, and it's very important for you to understand. And this is one of the measurements we check with right heart catheterization. We talked about right atrial pressure, which is equivalent to the central venous pressure, CVP. When we say CVP, basically we're talking about the pressure in the venous compartment, the pressure right here just above the right atrium. We check the blood pressure in this area. That's what central venous pressure, and basically it's equivalent because these channels are open on each other, right? So the pressure is equivalent. That's why these are basically the same. And in people with Swan-Ganz catheter, usually we can directly check that, and as I mentioned, usually you will see this continuously monitored on the screen. I'm gonna just zoom in for a second. You see this CVP and this blue waveform. This is the right atrium waveform, and this is the CVP, and this is the reading of the CVP. So it's continuously monitored. Let me zoom out. So this is how you identify it on the screen. Now, what's the value of this? As you can tell, it's measure the pressure of the blood. Normally, we range from 0 to 7 or 8 millimeter Hg. So if it goes up, that means more blood is building up in this area, right? And then you start wondering, why is that? Either there is an increased volume, like hypervolemia or volume overload, or there is decreased pumping out of the blood in this direction out of the right ventricle, like cases of right ventricular failure or right ventricular infarction, right? So you could think also constriction or squeezing of the right ventricle, like constrictive pericarditis or cardiac tamponade, or left to right shunt. That will increase volume here. You don't have to memorize, you can think about just this way. Usually we say, okay, the increased central venous pressure means increased volume in the body, and these people need diuresis. Well, if it's like this guy has 20, right, so this is high, and if it's low, then it means people needs volume. Again, I'm going to explain separately the assessing volume status in critically ill patients, and this is $1 million question, because quite often in ICU we'll encounter a case where you're in the middle. Does the patient needs fluid or needs diuretic? And that's what I'm going to talk about in a separate video. But the CVP is only a way to help and guide you. You have to rely, along with this number, on the clinical exam history and other tests like echo and chest x-ray to decide how to adjust or how to treat this CVP. As you know, if you have volume overload, for example, from left-sided congestive heart failure, you can diurese the patient, right? But if it's right-sided heart failure, is it from right ventricular infarction where people are preload dependent and they need volume actually, or you need to avoid diuretics? Or if it's just RV failure from, let's say, severe pulmonary hypertension, where you have to be really careful in diuresing if you need that.